So what do we do if our QuickSplint doesn't work, or better said, doesn't work the way we expect it to work? One of the great things about a QuickSplint is it's going to accomplish our goals of relaxing the muscles, unloading the joints, and helping our patients prevent jams or manage the symptoms of jams a large majority of the time. And when it doesn't do that, that's actually really valuable information. So that tells us a lot about what's going on for this person, about their ability to parafunction enough and apply enough force that they can actually overcome the beneficial properties of a QuickSplint. Or that what's going on for them maybe isn't as simple as something going on with their joints and muscles or an occluso-muscle relationship. So I really want to make sure that we set this up so that all of you in the dental office know, but you can also share with your patients that we've learned something very valuable at a diagnostic level if the patient's response to a QuickSplint isn't that, oh my gosh, I feel so much better, everything has gone away and I can open wider, and we love to hear those things. The reality is when we hear the reverse, it's valuable information. So whether you're going to now treat that patient in your practice and you're actually going to continue your diagnostics around what's going on for this patient, whether that be TMD or a different type of an orofacial pain problem, or you're going to refer that patient to somebody else now who can pick up that treatment, sharing that diagnostic information that we did make a QuickSplint. This is what the patient was experiencing before we did it. And this was the patient's response, or this is what they experienced with the QuickSplint. We've now actually shortcutted that diagnostic process for that next patient. That's valuable, important diagnostic information. And I actually will share that with my patients when I make them. I actually will tell my patients, one of three things is going to happen with this little device. You're either going to feel better, and that's awesome, and we love that, and that's important information for both of us. Or potentially, you may feel exactly the same. And that's awesome because we've gathered some really valuable information. And there's a chance that you may actually feel worse. And I know it doesn't sound awesome, but it's awesome because we've actually learned something very important about how we're going to move forward with your diagnosis and your treatment. So in case you were wondering what to do if a QuickSplint doesn't do what you expect, you now know it's an important piece of your diagnostic process.